On consumer-directed Health Select is going to be recorded. With me here today, I have Pat Garcia from United Healthcare here to talk about the high deductible health plan. I also have Allison Marek here to talk about the prescription drug coverage, and Christy Noneman from Optum Bank to talk about the health savings account. So with that, I will go ahead and turn it over to Pat, who will go over the next steps of the presentation.
Good morning, everybody. For our agenda today, we will review the plan. There's two components to the plan, and we will review how each component works. We'll also review the high deductible health plan, as well as the health savings account, how that works, the important tools and customer service for your health savings account. And then, of course, we'll discuss some important considerations, and then at the very end, we'll have question and answer. The Consumer-Directed Health Select is a new option that's available starting September 1st, 2016 for employees and retirees not eligible for Medicare. Two key parts make up the new plan: a high-deductible health plan, also known as an HDHP, and a health savings account known as an HSA. United Healthcare will be administering the HDHP plan. Optum Bank is a subsidiary of United Healthcare Services Incorporated, will be administering the health savings account. The Consumer-Directed Health Select plan is made up of two different parts: medical coverage through a high-deductible health plan and a health savings account. The medical coverage will cover and exclude the same services as Health Select of Texas. The biggest difference is there is no bariatric surgery benefit through the Consumer-Directed Health Select plan. That particular benefit is only available to Health Select of Texas participants. Coverage in-network for preventive care is covered at 100% of eligible expenses. You will not need to designate a primary care physician, and you will not need a referral to see a specialist. It will have lower monthly health insurance premiums for those covering dependents. Because of the high deductible, you could have much higher out-of-pocket costs for non-preventive services and prescriptions than in Health Select of Texas and the regional HMOs. The HSA will help cover your deductible and other out-of-pocket qualified medical expenses. It will help lower your taxable income through tax-free contributions up to a certain amount each year. You can receive pre-tax contributions from the state of Texas if you're an active employee or retiree. You can grow tax-free and provide tax-free withdrawals for your qualifying healthcare expenses. Retirees and participants who pay their insurance premium directly to ERS can make post-tax contributions directly to their HSA through Optum Bank. The medical claims are processed by United Healthcare, which is also the third-party administrator for Health Select of Texas. Your HSA can be used to pay for qualified out-of-pocket expenses not paid by the health plan, is available through Optum Bank, and you're eligible for an HSA. You will have the opportunity to set one up when you enroll in Consumer-Directed Health Select. First, let's take a look at the high deductible health plan. Your plan has three parts: your deductible, your coinsurance, and your out-of-pocket maximum. We'll learn about each of these three parts in the coming slides. But before I move on, though, I should mention that all of these parts are affected by whether you use network providers. As you can see in the slide, it pays to stay in the network, and the Health Select network includes tens of thousands of doctors and other providers in Texas alone. A requirement for the high deductible health plan is to have a deductible for non-preventive expenses. The deductible is the amount of money you must pay before your health plan will pay for eligible health care expenses. For preventive care services, you do not have to pay a deductible or coinsurance. Coverage is at 100% when you use a network provider. If you go to an out-of-network provider for preventive care services, you will be responsible for paying the out-of-network deductible and coinsurance. When you have an eligible expense, like a doctor visit that is not preventive care, the entire cost of the visit will initially apply to your deductible. You will pay the full cost of your non-preventive healthcare expenses, including prescriptions, until you meet your deductible. The good news is that these are still negotiated discounted rates when you are using the UHC network of providers. That's one way the network saves you money. The other is that your deductible is lower for in-network services, so the plan could start paying some of the costs sooner. You can choose to pay for your care from your HSA as long as you have money in your account to cover it. Unlike with a healthcare flexible spending account, you cannot pay for care with money that isn't in your HSA yet. Or you can choose to pay another way, like with cash or a credit card, and let your HSA grow. It's your money, so you decide when to use it. Once you have met your deductible, all qualified medical expenses are then covered at 80% coinsurance when you use a network provider. You will only pay 20% of the eligible charges. Coinsurance is a shared expense between you and the plan. Again, it pays to stay in the network. The plan will pay only 60%, and you'll pay 40% coinsurance if you go out of network for care. Remember, preventive care services are covered at 100% when you use a network provider. Like the deductible, you can choose to pay for your care from your HSA, or you can choose to pay another way, like with cash or a credit card, and let your HSA grow. But what if you have a sudden or ongoing more serious medical situation? You're protected for major expenses with an out-of-pocket limit. The amount is the most you have to pay each year for covered services. To recap, in one step, you would need to first satisfy your deductible. If you're using a network provider, then your deductible would be $2,100 for individual coverage and $4,200 for family coverage. Once you satisfy the deductible, you would then be responsible for paying 20% coinsurance, and the plan would pay 80%. Once you reach the total out-of-pocket maximum, which is $6,450 per individual and $12,900 per family, the plan will then pay 100% of remaining covered expenses for the rest of the calendar year. And don't forget, your out-of-pocket maximum is lower if you use in-network providers. The new Consumer-Directed Healthselect Plan website features a plan cost estimator that allows you to enter information about you and your family's health needs and finances. Check for the link under Medical Benefits. The estimator will look at the possible costs you might incur and add health savings account contributions. You can review what your overall cost and savings might be under the new Consumer-Directed Healthselect compared to Healthselect of Texas. If you use the estimator, please keep in mind that it can give you only an estimate of what your cost and savings might be, but it won't predict things like accidents that might lead to emergency medical costs.
Thank you, Pat. And with that, we're going to turn it over to Caremark, Allison Mark. So let me switch over to the next slide. And all right, you can go ahead, Allison.
Thanks, Christina. So now it's important to talk about prescription costs. If you're currently in Healthselect of Texas or an HMO, you're probably used to paying a $50 per person annual deductible for prescriptions, and then maybe no more than $75 for a 30-day supply of drugs from a network pharmacy. In Consumer-Directed Healthselect, you could pay much more for some drugs, possibly hundreds of dollars depending on the drug, until you meet the deductible. After you meet the deductible, you'll pay coinsurance, 20% of the prescription cost if you use a network pharmacy, not a copay. If you're thinking about enrolling in Consumer-Directed Healthselect, you should consider any prescriptions you take and learn what the full cost of these prescriptions are. Fortunately, Caremark, which will administer prescription benefits for Consumer-Directed Healthselect, has a cost estimator available for you. Knowing the cost of your medications is important. Here's an example of what you will pay for a 30-day supply of Dexilant, a Tier 3 maintenance medication under Healthselect of Texas, versus what you'd pay for the same drug under Consumer-Directed Healthselect. The full cost of this specific drug is $247.54. Under Healthselect of Texas and the regional HMOs, you only pay a deductible of $50 per participant per year. The deductible is much higher under Consumer-Directed Healthselect, which could be $2,100 or $4,200, depending on whether you've chosen individual or family coverage. Before you meet the $50 drug deductible under Healthselect of Texas, you would pay a total of $125 for Dexilent at a network retail pharmacy. Under consumer-directed Healthselect, you'd pay $247.54 at a network retail pharmacy until you meet your health and prescription deductible of $2,100 or $4,200. After you meet the drug deductible under Healthselect of Texas, you would pay a total $75, which is your Tier 3 copay for the drug. And if you meet the high deductible under consumer-directed Healthselect, you'd pay $49.51 for Dexilent, which is 20% of the full cost of the drug.
Thank you, Allison. And with that, we are going to turn it over to the health savings account portion of this presentation. Christy, you can go ahead and take it away.
Great. Good morning, everyone, and thank you for joining. I'm going to share some information with you about the health savings account specifically. And really, a health savings account is just like a personal bank account that you own that has certain tax advantages assigned to it. So money that goes into this account can be used to pay for current health care expenses and can be saved for future health care expenses, even into retirement. Any funds that go into the account are completely exempt from taxes. Any interest that is earned in the account or even investment earnings are growing on a tax-free basis, and all the withdrawals from the account are taken from the account on a tax-free basis as long as they're used to pay for qualified health care expenses. And as I mentioned, this account is not only for current health care expenses but for future health care expenses, and it allows you to grow your money long-term because once you have over $2,000 in your HSA, you can choose to start moving some funds into mutual funds and investments so that you can grow your savings for long-term use down the road. Next slide, please. So the HSA really has triple tax benefits. Again, the money is not taxed when it goes in, it's not taxed when it grows, and it's not taxed when the money comes out, as long as it's used for qualified health care expenses. The key here is that this account is a personal account that you own, so you decide when to use the funds in the account, how to use the funds, and if there are any funds left over at the end of the year, they actually carry over to the next year. So unlike flexible spending accounts, the money is not lost. It's yours to remain throughout the life of when you have the account. So it doesn't matter if you switch jobs, you change health plans, or move into retirement, any funds that have been deposited to the account while you've had it will always remain yours to spend on qualified health care expenses. The nice thing is that you can use the money, as I mentioned, tax-free for qualified health care expenses, and we'll talk a little bit later about what those entail. If you choose, you also have the flexibility to use the funds for other reasons. However, it's kind of like taking money out of an IRA prematurely. If you choose to use the money in your account for a non-qualified health care expense, there are taxes and penalties that are associated along with that. So as far as this account is concerned, it is governed by the IRS, and the IRS does have very specific rules for eligibility. First and foremost, they're extending a very rich tax benefit to you. So in order for you to be able to take advantage of that tax benefit, they want to make sure that you're potentially going to incur additional out-of-pocket costs. So first and foremost, they say you need to be covered by a qualified high-deductible health plan. A qualified high-deductible health plan is really a plan that combines the medical and prescription expenses towards one deductible, and the IRS also defines high deductible plans as having a minimum deductible, and they also set a maximum on out-of-pocket contributions. Fortunately, the consumer-directed Healthselect plan that's being offered to you qualifies as a high deductible health plan. In addition to having to be covered by a qualified high-deductible health plan, you also cannot be covered by any other plan that isn't a qualified high-deductible health plan if you want to open up the HSA. So you need to be careful that when you're looking at your benefits, that you certainly, if your spouse is going through an open enrollment time, you want to make sure that you're not covered by any other health plans that your spouse may have that would disqualify you from being able to open up an HSA if that's something you want to do. Other types of coverage that could impact your ability to open up an HSA would include Medicare, coverage under Medicare. Now, it's okay if your spouse is covered by Medicare. You as the account holder just cannot be covered by Medicare. In addition to that, you cannot be covered by TRICARE or TRICARE for Life because these are all benefit programs that would pay before your deductible is met. The IRS also stipulates that you cannot be claimed as a dependent on someone else's tax return. And they also say that you cannot be covered by an FSA program, what we call a full purpose FSA. However, there's something referred to as a limited purpose FSA that pays for only dental and vision expenses that is considered compatible with an HSA. If you happen to be in the TextFlex healthcare account today and you want to enroll in the consumer-driven Healthselect plan, if you currently have a balance between $25 and $500 after August 31st of 2016, ERS will open up one of these limited purpose flexible spending accounts on your behalf, and those funds going forward will then be allowed to be used towards dental and vision expenses only. Also, it's important to know that you can't be covered under your spouse's FSA either. So when we talk about having other coverages, not only can you not be covered under a spouse's non-qualified health plan, but you also can't be covered under a spouse's FSA. So if you're thinking of moving to the HSA, make sure that you're not covered under a spouse's FSA. So they may want to defer on that type of coverage. Dependent care FSAs have no impact on HSAs, so daycare-related expenses are not impactful. Next slide, please. You're probably wondering who Optum Bank is. Optum Bank is a subsidiary of United Healthcare Services, and we will be the custodian of your health savings account. We are dedicated solely to healthcare banking. This is all we do, so we don't do retail banking. And we are actually the leader in health savings accounts across the country. While it says here that we have 2 million account holders, that's actually just recently grown to close to 3 million account holders. And some of the benefits of Optum Bank being owned by United Healthcare is that you will have very easy access to your account information at the same places that you go to view medical information. So you'll be able to actually access your account through myuhc.com/HS, where you go for regular healthcare information. You'll have single sign-on to Optum Bank. You'll be able to get access easily to your account information, including balance, all your transactions, things like online bill pay. In addition to that, you'll be sent reimbursement options. We have a debit card that you'll be sending to access account information or account dollars. And then you also have the chance online to invest in mutual funds once your account exceeds a certain dollar amount. Next slide, please. So in order to start using the benefits of the health savings account, you actually have to go and open up a health savings account. You can do that during the summer enrollment by completing the application that is going to be provided to you in a link in your ERS account online. So you'd click on that link, you'd complete the application. Once that application is completed, Optum Bank is going to send you a welcome kit that typically comes within 7 to 10 days. It'll include information on how to access your account, eligible expenses, some banking disclosure information. And in addition to that, you're also going to receive a second mailing that contains your debit card. Please be on the lookout for this mailing, as it will come in a plain white envelope for security purposes. So make sure that you don't toss it accidentally. In the event that you do lose your card or you need additional cards, they're easy to order online or through customer service. There's no charge for additional cards. Something important to know is with the HSA, the effective date of when you'll be opening up this account for someone who's not had an HSA previously is September 1st, 2016. That date is important because it means that that's the date going forward for which you can reimburse yourself for eligible health care expenses on a tax-free basis. So really what that means is that if you are incurring expenses over this summer before September 1st, those expenses cannot be paid tax-free out of your HSA unless in the event that you actually have an HSA today, perhaps from another employer. So now that you've got your account open, you're probably wondering, how do I go about getting funds into my account? How can I contribute? Who can put money into my account? Well, if you're an active employee, you can make contributions to your account via regular payroll deductions. You also have the ability to make a direct contribution to the account via check, via an online ACH from your personal bank account over to your Optum HSA account, or a rollover from a prior HSA or an IRA. If you happen to be a retiree or a COBRA participant, those contributions, since you don't have payroll deductions, your contributions will be made on a direct basis, again, through the same mechanisms, checks or online or a rollover to the account. Keep in mind that even if you're unable to make a contribution through a pre-tax payroll deduction, you can still get the tax benefit as you claim any contributions you make to the account on your tax return at the end of the year as an above-the-line item deduction. So the tax benefit still remains. The state of Texas is actually also going to be contributing to your account if you're an active employee or a retiree not enrolled in Medicare. The state's going to contribute $45 per month for those of you who elect single coverage. That equates to $540 annually to help offset your deductible. If you elect family coverage, that will equate to $90 per month or $1,080 annually. It's important to know that these contributions, in addition to any pre-tax payroll deductions or after-tax deposits that you make to your account, all count towards the maximum contribution that the IRS allows during the year. So it's important that you know that it's your responsibility to make sure that your total deposits do not exceed the IRS limits. And we have some tools that will help support you in keeping track of that. Speaking of contribution limits, every year the IRS sets a limit as far as how much you can contribute to the account based upon what type of health insurance coverage you've selected. So what level of health insurance, whether you've taken single or higher levels of coverage. So anything above an individual coverage is considered family. So for 2016, those limits are $3,350 for an individual, for family $6,750. We just recently got the 2017 indexed amounts, and for individuals, that limit is increasing $50 to $3,400, and the IRS is maintaining the family limit at the $6,750 where it was previously. So again, keep in mind this is inclusive of your contributions and any contributions the state makes on your behalf. Also, for those of you who are age 55 and above, you can actually make something we call a catch-up contribution to your account. That catch-up contribution can be up to $1,000 and can be made annually for anyone 55 and above to help you grow your account balances faster. Next slide, please. Oh, I want to real quick go back. I just wanted to make a comment. This came back up in one of our previous calls. I understand there's a lot of individuals that work for the state that have their spouses working for the state as well. In that event, while you could open up one account and use it for both parties, it's in your best interest for both the individuals, the employee and the spouse, to open up, and I guess they're both employees, but to each open up their own account, because that will allow you to maximize the contribution that the state will be providing to you. So as far as contributions and how these contributions can be spent, the IRS has a list of qualified expenses that are eligible for tax-free reimbursement. And probably to make this easier for anyone who's participated in a healthcare flexible spending account in the past, this list mimics, for the most part, what you can reimburse yourself for from a healthcare flexible spending account. So really, it's all the types of expenses that your health plans don't fully cover or perhaps don't cover. That would include expenses that are related to, subject to deductible or that you pay co-insurance towards. That would encompass office visits, specialist visits, emergency rooms, lab and x-ray expenses. So all the medical expenses that are going to be, at least partially covered by your health plan. In addition to that, the HSA will also reimburse you for dental and vision-related expenses. So contact lenses, glasses, orthodontics, those are all considered eligible expenses. Contact lens solutions and prescription drugs are certainly eligible for reimbursement tax-free through your HSA. What's nice about the HSA is while the IRS does consider these individually owned accounts, you can use the money in your account for any of your legal tax dependents. So it doesn't matter if your spouse or your children are covered under your health plan, you can still use the funds in your HSA to pay for any of their out-of-pocket expenses. We'll be providing you with a list of qualified expenses on the Optum Bank website, and I believe there will also be a list that will be provided with your welcome kit. So in addition to the traditional expenses that you may be used to being reimbursed for from a flexible spending account, an HSA actually extends that list of qualified expenses to certain types of premiums. The premiums include if you're paying for health insurance while you're receiving unemployment benefits, that's an allowable expense for the premiums. You can also pay your COBRA continuation premiums on a tax-free basis through your HSA. Thirdly, you can pay for eligible long-term care expenses. And lastly, Medicare premiums are considered eligible for reimbursement. So I know I personally am saving up funds to offset my Medicare premiums when I get to that age. So not only is it your Medicare premiums, but certainly any out-of-pocket expenses you might incur while you're covered by Medicare. The same holds true with COBRA. Keep in mind that Medigap or Medicare supplement policies are not considered eligible for reimbursement on a premium basis, but certainly all your Medicare premiums, B, C, and D, would certainly be eligible. So now that you have opened up an account and you have funds in your account and know how to spend them, how do you have access to those funds? We'll be issuing to you a United Healthcare Savings Account Debit MasterCard. This is the debit card that will come in the mail to you in that plain white envelope. You can use it at point of service with either a signature or a PIN number. You'll actually self-select your PIN number when you activate your debit card. You can request additional cards for a spouse or for dependents over the age of 18. Maybe you have a child that's a student in college and you want to send a card to them. It's as easy as just clicking on a link, which I'll show you on the website, or you can contact customer service. And there's no additional cost for debit cards or additional cards. The debit card can be used at point of service, so at your doctor's office. It can be used at an ATM to withdraw cash to reimburse yourself for an out-of-pocket expense. Something I want to point out is always make sure you process and make sure that your claim is being submitted to United Healthcare first so that they're applying any out-of-pocket expense you have to your deductible, and you can take advantage of all the discounts that United has negotiated for you, and then use your debit card to pay for your expense once you know what your true liability is. While we provide a debit card, there's also other ways to access funds in your account. You can request a checkbook. We send out checkbooks with 25 checks, and those are available upon request. We also have a free online bill pay that you can access online where you can set up one-time or recurring payments to a provider. And it stores your data so that if you want to set up a payment to your orthodontist, that payment information will remain in the system until you choose to remove it. What's unique about these HSAs is that they are different from a flexible spending account in as much as the relationship and responsibility is not between you and a third party, it's between you and the IRS. So Optum Bank is not going to be auditing any requests for reimbursement. Since the funds are yours and you make the decision on how to spend them, the only difference is the tax treatment of those expenses. So if you use the money for qualified health care expenses, you receive the full tax benefits of tax exemption. If you choose to use it for non-qualified expenses, you're subject to taxes and penalties. So the decision there is between you and the IRS. So you just need to make sure that you keep your receipts so that if the IRS ever audits you, you have the documentation to prove that the expense was qualified if indeed you remove those funds on a tax-free basis. Somebody asked how long they should keep their receipts, and I always say that the IRS has a 7-year threshold, and I would say that would be 7 years from the date that you request reimbursement. And that kind of brings up another point, is that the nice thing about an HSA is that you do not have to request for reimbursement in the year that you've actually incurred the expense. Since this account can be used for current and future healthcare expenses, you can actually reimburse yourself years down the road for an expense that you would have today, or I should say an expense you'd have any time after September 1st, and you could reimburse yourself years into the future for that expense. You don't have to reimburse in the same year that that expense is incurred. So this is just a snapshot of probably a view that you're familiar with, going to myuhc.com to check healthcare information, to look up doctors. Well, this is where you'll also access your HSA. As you can see, there's in the bottom box, it says Optum Bank HSA, so it's a tab that you can click on that immediately single signs you over to Optum Bank where you can view all your account information. Next slide, please. From there, without needing additional passwords, you'll get into your Optum Bank account. It will provide basic information for you, some of the most requested information our account holders ask. Typically, they want to know what their balance is, not only what's available in cash, they also want to know what's there in investments. That's right up front. Remember I said that you could order a debit card if you were interested, or additional debit cards. That's simple to do. There's a button there right in the middle that says Need Additional Cards. You just click on that. If you need to pay a bill, click on that. So some of our most commonly requested items are pulled right up front. And we talked previously about the responsibility to keep track of how much you're contributing to the account. Optum Bank will actually track a lot of that for you. We will take in information to know whether you're covered by an individual policy or a family policy. In the event of, regardless of which event that is, we will track to the IRS thresholds for that particular coverage level. And we'll also take into consideration your age. You'll be able to see where you're tracking to, not only for this year, this coming year, but once you move into future years, you'll be able to see the prior year as well. So it will help support you in tracking to account maximums. So there are a lot of tools and resources that we're going to provide to you to really help support you in accessing your account information and understanding the best way to utilize and leverage your HSA, not only for current healthcare expenses, but for the future. Today, certainly the website provides a host of information, but you also will have access to your account information via mobile applications. Anyone using the Health for Me mobile app through United Healthcare today who elects the HSA will have an additional tab on their mobile device that says accounts, and you'll be able to look in and see your account balance at a moment's notice. You actually can even pay claims from your HSA through your mobile device. In addition to that, the Optum Bank website provides a complete mobile experience when accessed on a direct basis, and it's optimized for the device that you're on. So whether you're accessing the site from your tablet or from your iPhone or Android, it's easy to use, easy to maneuver, and can access account information, even investment information from your mobile device. Some of the tools that United provides to help you in making decisions about how you spend your healthcare dollars include the My Healthcare Cost Estimator tool, which will help you figure out the cost of a procedure or a course of treatment. And what's nice is every time you utilize that calculator, your HSA account balance will be included in the calculation information so that you always know how much money you have available to pay for a particular expense. From a communications perspective, we provide a host of self-guided tours and videos. These are quick tutorials that are provided online. Some are as short as 2-minute answers to questions. Others are HSA 101 or how to invest. And those are available online through MyUHC so that you can actually look at that information at a later point in time. You can share it with your family if they want to learn more about how these accounts work. It's always there and available for you. Now, I want to point out a tool down in the lower left-hand corner that I find extremely valuable. It's called our Health Savings Checkup Calculator, and it's actually accessible from the home screen of Optum Bank. It's a calculator that helps you determine how much you're going to need to save to pay for health care expenses in retirement. And it's based on not only when you expect to retire, how much money you currently have in your HSA, it takes a look at what your health conditions are, and also takes into consideration what Medicare will pay, and does a projection as to how much they feel you're going to need based on different conditions. It's a great tool to help you do planning relative to retirement planning, because most of your 401k calculators only take into account living expenses and don't incorporate healthcare related expenses, which can certainly be a big cost in retirement. So I encourage you all to take advantage of that. We talked about the contribution tracker, and finally I want to just touch really quickly on something called our receipt vault. As I mentioned, it's your responsibility to keep track of your expenses and to maintain your receipts in case you're ever audited by the IRS. We have a great way to do that. We have an electronic storage capability where you can either scan or take a picture with your mobile phone to record a receipt or an explanation of benefits to show that you've had an out-of-pocket expense, and you can tuck it away in various files online. You can decide how you want to organize that information. Is it by type of expense? Is it by member within your family? You can also annotize that list, and for each expense that you import, you can say, gee, I paid it from my HSA, or no, I haven't yet. Maybe it's something you're going to save to reimburse yourself for in the future. So you can take various notes and identify who it was for. So it's a really nice tool to help you manage your receipts on a long-term basis, so that you can store those. It sure beats the shoebox I've been using for years. So I'm working through the process of taking all my receipts and electronically transferring those to a more permanent storage. So I'm going to, at this juncture, turn the call back over so that we can talk a little bit about a wrap-up and customer service and make sure you're on your way to making your elections and having the information you need to move forward.
Thank you, Christy. And we're going to go ahead and turn it over to Pat to talk about some of our Healthselect resources.
Thank you. With the Consumer Direct Healthselect plan, you will still have access to the dedicated customer service team in San Antonio. To contact the team, you would call customer service at 1-866-336-9371. Or you can also dial TTY 711 for the hearing impaired. It will be staffed with trained health advisors to assist you with questions or HSA balance and enrollment inquiries. They will also be able to transfer you to Optum Bank for detailed transaction assistance. The Customer Service Center is available Monday through Friday from 8 a.m. to 7 p.m. Central Standard Time, and Saturdays from 7 a.m. to 3 p.m. Central Standard Time. The option to call Optum Bank directly, you can call 1-800-791-9361. The number will be listed on the back of your debit card. We also have two dedicated websites available for your use as well. www.healthselectivetexas.com/CDHS for general plan information on the Consumer Directed Health Select plan, and also your personal account, www.myuhc.com/HS, so that you can access your personal account information as well. Some of the final considerations. If you're thinking of enrolling in Consumer Directed Health Select, there's a few things to consider. Because Consumer Directed Health Select is comprised of a high deductible health plan, your out-of-pocket costs may be much higher than what you pay under Healthselect of Texas or an HMO. As with non-preventive medical services, prescription drugs do not have co-payments and will be subject to the deductible. That means you'll pay the full cost of prescription drugs until you meet the deductible. After that, you'll pay 20% of the full cost at a network pharmacy. You'll have access only to funds that are actually in your health savings account, not any funds that are pledged to be deposited in the future. Because the state's HSA contribution will be made in monthly payments starting on October 1st, for your September pay period, it might be a while before much has accumulated in your account, depending on what you contribute when. You will have access to the same network of providers as with Healthselect of Texas. Remember to use network providers to lower what you have to pay out of pocket. Preventive care services are covered at 100% and not subject to the deductible or coinsurance when you use an in-network provider. If you use a non-network provider for preventive care services, coverage is at the out-of-network coinsurance after satisfying that deductible. If you enroll in Consumer Directed Health Select on September 1st, 2016, any qualified out-of-pocket costs you've paid in Healthselect of Texas since January 1st, 2016 will be carried over to the new plan and applied to the out-of-pocket maximum and deductible if applicable. However, because the Consumer Directed Health Select plan has a deductible, you will need to satisfy the full deductible before the coinsurance applies. This applies to both non-preventive medical costs and prescription drug costs. On January 1st, 2017, this deductible and your out-of-pocket maximums will start over. The deductible amount will vary depending upon whether you have individual or family coverage. For individual coverage, only the individual deductible amount will apply. For family coverage, only the family deductible will apply. The individual deductible is not applicable. The family deductible could be satisfied by one person or several people in your family. Consumer-directed Healthselect does not require you to designate a primary care physician, and it does not require you to obtain a referral to see a specialist. If you are eligible for Medicare, even if you haven't enrolled yet, you cannot enroll in a consumer-directed Healthselect plan.
Thank you, Pat. And with that, we're going to open it up for questions. So if you look on the right-hand box, you'll see a little box for questions. If you just want to enter them in there, we'll give you all a couple minutes to do that, and then we'll read the questions out loud, and one of our specialists will answer your question. Okay, and it looks like our first question is, are preventive costs applied to the deductible?
No, they would not be applicable to the deductible because preventive care, as long as they're rendered by an in-network provider, would be covered at 100%. Only non-preventive care, such as a flu, some type of office visit, other than preventive care, that would apply to the deductible.
Our next question, I'm Medicare eligible but not yet on Medicare, so I'm not yet eligible for this plan, correct? And so for this, even if you're actively employed or if you're retired, if you're eligible for Medicare, you're not eligible for this plan. I don't know, Pat, if you want to speak more on that.
That is correct. If you are Medicare eligible, even if you have not enrolled, you would not be able to enroll in this particular CDHS plan.
Thank you. And looks like we don't have any other questions. So while we're waiting for other questions to come in, I just wanted to go ahead and point out some of the resources that we have on the website. If you go to healthselectoftexas.com, you can go to Consumer-Directed Healthselect. And we mentioned earlier on the presentation that you can look at the plan cost estimator. If you go under medical benefits of Consumer-Directed Healthselect on the United Healthcare website, you can look at the plan cost estimator. Looks like we have another question. If preventive care is rendered by a non-network provider, then the cost I pay out of pocket would apply to the deductible, correct?
That is correct. If you receive preventive care services from a non-network or out-of-network provider, what you pay out of pocket would apply to the deductible, but please note that the out-of-network deductible is $4,200 for an individual and $8,400 for a family coverage.
It is important to note that there are those separate deductibles. There's one for the out-of-network and one for in-network.
Correct.
And so if anybody is interested in joining this plan, I encourage you to use the plan cost estimator that United Healthcare has just put on their website. You'll be able to enter in information about your health needs and your finances, and it already factors in the health savings account contributions. And so you can put your family members' names and ages and any other type of medical conditions that they may have. Okay, we have a question. If I declare for a family, do I have to meet the out-of-pocket maximum amount for family before the plan pays 100%? So with the, yes, if you have family coverage, you'd have to meet that whole deductible. So for an in-network, that's $4,200. So that is the amount that you'd have to pay out of pocket. And the plan wouldn't pay 100%. For in-network services, you would be responsible for 20%. The health plan would be responsible for 80%. For anything for preventive care, if you just go for your annual checkup, that's going to be covered at 100% as long as you see an in-network provider.
And please note that the out-of-pocket maximum that you would need to meet for family coverage before the plan pays at 100% would need to be $12,900 for family.
Okay, yeah, thank you for clarifying that, Pat. So yes, that's correct. After you meet that deductible and the plan starts paying co-insurance and you've met that out-of-pocket maximum, then yes, the plan does pay for 100%. Okay, and so while we're waiting, I also want to show you where we have other places on our website that have resources. recently added, if you go under employees, you can even go under retirees too. Just go under health benefits, and then consumer-directed Health Select. You can watch a video that that ERS produced or helped produce, and then you can also find information about the high deductible health plan and the health savings account. We also have a number of articles under employee news that you're welcome to check out. There's fact sheets. And also, if you're a retiree or if you're any other type of participant, you'll want to look under that appropriate tab, especially for the health savings account, because it works a little differently for retirees and other participants. And it looks like we have one more question. What are the premiums for this plan? I assume they are found on the website. Yes, they are. So if you look on the page that I'm on right now, you go to rates. You have to look on the left-hand navigation, and you can use this. You can use our rates calculator. Just click on September 1st, 2016, and you can kind of navigate through here. Your other option, if sometimes compatibility settings on some people's machines won't always allow this calculator to work, so we also have the information in a document format. So as you can see here, just looking on this document, you'll see that, for example, you plus spouse under Consumer Directed Health Select is $318.32. That includes the health savings account contribution. And then just in comparison, you can see Health Select of Texas for you plus spouse, it's $353.68. Okay, everyone. Well, I thank you for joining us this morning. If you have other questions, you can always feel free to send them our way. The wrap-up email that should be sent to you will give you a reply email. You can ask us questions there. You can always call United Healthcare. You can call Caremark. You can also talk to Optum Bank if you have any specific questions about the plan. But thank you and have a great day.